Hello, and thank you for joining us today for an introduction to the Strengthening U.S. Response to Resistant Gonorrhea Project, provided by Healthcare Education and Training in collaboration with the Centers for Disease Control and Prevention, Strengthening U.S. Response to Resistant Gonorrhea Project, and by Wisconsin Division of Public Health Sexually Transmitted Infection Unit. After completing this module, you will be able to define antibiotic-resistant gonorrhea, or ARGC, understand the prevalence of gonorrhea, often shortened to GC in the United States, identify one goal of the Strengthening U.S. Response to Resistant Gonorrhea Project, also known as the SURRG project. People who are sexually active can get gonorrhea, a common sexually transmitted infection, or STI. Gonorrhea can affect the genitals, rectum, and throat. It can be treated and cured, but it is highly skilled at outsmarting the antibiotics used to treat it. Drug resistance, also known as antimicrobial resistance, happens when germs like bacteria develop the ability to resist and even defeat the drugs designed to kill them. This means the germs are not killed and continue to grow. From the 1930s until today, gonorrhea has grown resistant to nearly every drug ever used to treat it. These instances are referred to as antibiotic-resistant gonorrhea. In the 1930s, sulfonamide was used to treat gonorrhea. Due to growing resistance, penicillin was used in the 1940s and appeared to be effective for many decades. Gonorrhea's increasing resistance to penicillin and tetracyclines led to both medications no longer being recommended in 1989. In the 1990s, fluoroquinolones were recommended to treat gonorrhea until resistance was again identified. By the 2000s, as resistance became more common, treatment recommendations changed rapidly to slow the development of further resistance and preserve the effectiveness of other antibiotics. In 2007, cephalosporins that included injectable ceftriaxone and oral cefixime became the backbone of gonorrhea treatment. By 2012, cefixime was no longer recommended to treat gonorrhea. In 2015, dual treatment with ceftriaxone and azithromycin was recommended. Then, in 2021, the recommendation changed to one dose of injectable ceftriaxone with azithromycin only recommended as an alternative if ceftriaxone may not be prescribed. We don't know how much time we will have until the bacteria becomes resistant to the last reliable cure for gonorrhea. Local and national efforts are underway to slow the spread of ARGC and to develop new drugs to treat gonorrhea. Gonorrhea is the second most commonly reported bacterial sexually transmitted infection in the United States. While infections have been common throughout the country, the number of cases has increased rapidly in the past decade. There are more than 500,000 reported cases of gonorrhea each year, and the Centers for Disease Control and Prevention estimates the actual number of new infections to be closer to 1.6 million. The more infections there are, the more likely gonorrhea will develop further antibiotic resistance. About half of the cases are resistant to at least one antibiotic. Today, the U.S. has just one recommended gonorrhea treatment option remaining. Before we go on, let's do a knowledge check. Choose the correct answer. How many CDC recommended treatments remain to treat gonorrhea? A, 2. B, 1. C, 3. There is only one remaining recommended treatment for gonorrhea. Gonorrhea and other sexually transmitted infections, or STIs, can affect anyone. Certain behaviors can reduce risk of exposure, like performing safer sex that can include condom usage, routine STI screening, and having open conversations around sexual contacts with partners. However, some communities have much higher rates of infection than others. These disparities or differences are not due to behavioral practices alone. Limited access to health care and sexual health education also increases the risk of being exposed to an STI. Access to health care resources is impacted by social conditions, policies, and systemic practices. For example, historical policies and practices like job discrimination or redlining, which is when housing and financial services are denied based on race or ethnicity. Discrimination from health care providers leads to distrust of the health care system. This may lead to hesitancy in getting tested or treated for STIs. Without routine screening, there is a chance that asymptomatic people may unintentionally pass on an infection. Systemic conditions like these can lead to increased rates of infections. In areas and communities with higher STI rates, it is easier to get an STI because your sexual partner or partners are more likely to have had an exposure. Knowing which groups are most affected helps us respond to the threat of ARGC more effectively. The rate of gonorrhea is consistently highest in the southeastern region of Wisconsin. However, the rate of gonorrhea increased most rapidly in the western region from 2020 to 2021. Milwaukee County has one of the highest reported gonorrhea rates in the nation. The city of Milwaukee has a long history of racial residential segregation and remains one of the most segregated cities in the country. This has a lasting impact on access to quality health care, support services, and health education. Across Wisconsin, the rate of gonorrhea reported by race is consistently highest among Black people. In 2020 to 2021, the highest rate increase occurred among Native Americans. The highest rates of gonorrhea are reported in the 20 to 24 year age group. The rate of gonorrhea reported in people assigned male at birth is 1.5 times higher than in people assigned female at birth. Wisconsin staff are working to improve the collection of information related to gender for non-binary and transgender patients. Despite these efforts, case counts among these populations tend to be low and cannot be disclosed in order to protect the privacy of these patients. While gonorrhea impacts persons of all genders, more work is needed to identify ways to share data on STIs among transgender and non-binary persons without compromising their identity. Before we move on, let's do a knowledge check. True or false? Disparities in the rate of STIs arise only because of individual actions. While individual actions may make us more vulnerable to a disease, individual actions aren't responsible for group differences in health. The group health differences we see are caused by systemic discrimination, political factors, and other policies and practices that affect healthcare access. So far, we have defined antibiotic-resistant gonorrhea and discussed how it impacts us. Now we will learn about what is being done nationally and in Wisconsin to respond to the threat of ARGC. In 2013, the CDC released the first report in history that looked at the burden and threats posed by antibiotic resistance on human health. This report named resistant gonorrhea among the 3 most urgent threats of its kind in the country. 1 year later, President Obama issued an executive order, and the White House developed the National Strategy to Combat Antibiotic-Resistant Bacteria, or CARB, both of which called for prevention, detection, and innovation against resistance. The National Action Plan for CARB was updated in 2020 to present coordinated strategic actions that the U.S. government will take to improve the health and well-being of all Americans by changing the course of antimicrobial resistance. This plan will continue to be updated in the future. To meet these national goals, the CDC Division of Sexually Transmitted Disease Prevention is supporting a number of new and continuing activities to prevent the bacteria from spreading and becoming resistant to our remaining treatment. Controlling gonorrhea in the U.S. relies on our ability to detect and treat each case of gonorrhea quickly and effectively with the right antibiotic. This work is done in many ways, as illustrated by the following key examples. Hiring and training state and local public health personnel. Increasing epidemiological investigations of gonorrhea cases in their sexual and social networks. Expanding the use of culture beyond male urethritis in STI clinics so that extragenital specimens and vaginal specimens are routinely collected. Exploring different ways to expand gonorrhea culture to sexual and social networks. Establishing e-test capacity as a rapid way to detect susceptibility and resistance. Rapidly providing lab results on resistance to providers and public health personnel to quickly identify, treat, and stop the spread of resistant gonorrhea strains. The Wisconsin Department of Health Services Division of Public Health Sexually Transmitted Infection Unit and the Milwaukee Health Department and Laboratory are engaged with the CDC to prepare a response to this imminent threat. These activities include the Gonococcal Isolate Surveillance Project, or GISP, and SURRG. GISP was established in 1986 to monitor antimicrobial resistance trends in gonorrhea. GISP collects gonorrhea specimens each month from the first 25 men with urethral gonorrhea who attend participating STI clinics. Participating laboratories test the specimens for resistance to antibiotics. This data is used to directly inform gonorrhea treatment recommendations. GISP continues to be the core antimicrobial resistant gonococcal surveillance system in the U.S. Improved surveillance through GISP helps quickly detect new cases of ARGC and decreasing effectiveness of treatment. This helps guide a timely public health response. Findings from GISP have directly contributed to the CDC's STI treatment guidelines. Additional information on GISP and links to recent publications can be found on the GISP website. The SURRG project began in 2016 as one of the national strategies to combat the threat of antimicrobial resistant gonorrhea. The National SURRG project has 3 goals: to enhance domestic gonorrhea surveillance and infrastructure, to build capacity for rapid detection and response to resistant gonorrhea through increased culturing and local antibiotic susceptibility testing, and rapid field investigation to stop the spread of resistant infections. One way this is done is by investing in the development of a Center of Excellence, or COE, in each state participating in SURRG. Centers of Excellence serve as a hub for enhanced ARGC testing services and innovations. Before we go on, let's do a knowledge check. Identify the goal or goals of SURRG. Select the best answer. A. Enhance gonorrhea surveillance. B. Increase culture collection for gonorrhea to perform antibiotic susceptibility testing, AST. C. Rapid field investigation. D. All of the above. All of these are goals of the SURRG project. As a part of our efforts to achieve these goals, the Wisconsin SURRG program is working to expand access to ARGC testing services, enhance capacity to identify potential cases of ARGC, and develop plans to guide state and local level responses to ARGC. This involves developing protocols for managing suspected treatment failure and outbreak response plans within ARGC. This way, we can swiftly and effectively react in situations where a case of gonorrhea does not show improvement according to the currently recommended treatment guidelines. You can access the full CDC treatment guidelines for gonorrhea in the resources tab of this module. The Milwaukee Health Department Laboratory serves as a statewide Center of Excellence reference lab for ARGC testing resources. Health professionals throughout Wisconsin can request their services, which include ARGC testing services and antibiotic susceptibility testing, help with alternative treatment decisions, and consultation for specimen collection for test of cure follow-up testing to be sure the infection was treated successfully. These services provided by the Milwaukee Health Department are free. Contact the DHS STI Unit SURRG Project Epidemiology Coordinator for emerging antibiotic-resistant gonorrhea to connect to these resources. Through this learning module, you should have gained an understanding of recent trends in gonorrhea, what antibiotic-resistant gonorrhea is, and how the Wisconsin SURRG program is responding to these conditions. Remember, gonorrhea is one of the most prevalent STIs in Wisconsin and is good at becoming resistant to antibiotics. There are persistent disparities by region, race, age, and sex. There is only one remaining recommended treatment for gonorrhea. We need clinicians, laboratories, health departments, and partners to help us better understand, prevent, diagnose, treat, and respond to gonorrhea. If you'd like to stay in touch, sign up for our STI email list. Email dhsdphargc@dhs.wi.gov if you have questions or a potential case of ARGC.